My name is Dr. Meredith Grimbowitz, and I'm a pediatrician with 20 years of practice experience in medicine. And I'm here to just describe a little bit about some experiences I've had this last year with the mRNA shots, COVID-19 testing, and censorship of myself as a healthcare provider who questions the safety and effectiveness of these shots in children and young adults. So kind of a counter to what you just heard. As a pediatrician, I don't consider this experimental mRNA shot a vaccine because it does not actually prevent the person who receives it from getting or transmitting the SARS-CoV-2 virus. The definition of a vaccine is a substance that's introduced into a person's body in order to prevent that person from getting a specific disease. And from the time I heard about these mRNA shots, the question in my mind was, why would a vaccine that you're trying to prevent a respiratory or GI illness, why would you not want to stimulate IgA immunity? So IgA immunity is the type of immunity that our body uses to prevent respiratory and GI viruses. As pediatricians, we give shots every day. We know this. IgA is secreted by your nose, your mouth, your lungs, and your GI tract. Dr. Sukarit Bhatki, who is a renowned virologist, has spoken out with similar concerns, and I like the analogy that he used. He said the nose, the mouth, the respiratory, and the GI tract are like the front door. With these shots, we have set a hyperimmune response, which is a very high IgG response. It's much higher than natural. And we have left our front door open because we have no IgA protection. So even though a person who has received this shot has IgG in the bloodstream, they do not have IgA to protect them from getting the respiratory virus and from also shedding viral particles. And as a matter of fact, recently they have noted that people who have had the shot they had the same amount of viral particles that they're shedding from their noses. So I disagreed with a lot of what I was hearing. I had a lot of questions, especially within the medical center, the medical clinic that I was working. And I'm 50 years old, and if I have a question, I'm going to ask it. And I'm going to keep asking questions until I get my answers. At one point at my job, I was told that I needed to stop speaking negatively in regards to the COVID-19 shots on emails within the system. I was told not to respond to emails with anything negative that I had to say or a question that may reflect negatively on the COVID-19 shots. And within the department, especially if any other physicians were on any of those emails. Oh, I have a lot more to say. But suffice it to say that... Put it down to a few minutes. Okay, let me just get some I had a 16-year-old in my practice who presented to me with seizures that started 5 hours after her first Pfizer dose. Her mom came to see me and was very, very upset because I was going to go through the whole kind of description of what had happened to her and how she presented most definitely a full-body seizure. And she was told by the emergency room physician that it was a psychogenic seizure. He used another term, a functional movement disorder, which means that essentially that it's a psychiatric issue. That was not reported to VAERS, and the mom was really, really concerned about that. I called at that time the pediatric neurologist that was there at the medical center where I worked, and was really surprised when she said, even if this is related to the vaccine, but she did not think it was, she would recommend that the child get the second shot because that child would get much sicker with COVID. My mouth sort of dropped, and I told the mom absolutely not. I wouldn't recommend it. She didn't do it. That mom did have to go on her own and get the lot number and report the seizures to VAERS herself. So my concern is that we are not seeing a true reflection of any adverse effects and injuries that may be occurring in kids. I have a lot more, but what I'll tell you is that I ended up being terminated from my job for speaking out about the concerns that I had. And I worked for Ochsner, and I worked there for 20 years, and I was a upper level administrator came to my office during clinic, pulled me aside, and told me I had three choices. He said I could, at that time, only me, put on an N95 mask and wear it at all times in the clinic from that day forward, which I said I'm not going to do. I could get a vaccine, which I wasn't going to do, or I could quit, and I don't quit. So I was terminated. So I just want you to know that this is happening, and that this has never happened that I know of in our country with anything like this, and this is not even FDA approved. This is experimental. So I appreciate your time.
Doctor, thank you for your time too, and appreciate you coming. Thank you.
Yeah.